G'day, I'm Dr. Teh from Australia. I'm a cannabinoid clinician. Today we're going to talk about cannabis. The two main compounds in cannabis I'm sure everyone knows about are THC, Tetrahydrocannabinol, and CBD, Cannabidiol. THC is the one everyone knows about. Psychoactive, it gets you high. It's probably the main component of medicinal cannabis, and it works through a myriad of ways. So all of these are backed by studies, but the pharmacological actions of THC include analgesia, anti-nausea, anti-inflammatory, antipruritic or anti-itch. It's a bronchodilator, a muscle relaxant, an antioxidant. It's neuroprotective, so it's protective against the general signs of aging such as Alzheimer's and just old age generally. So it's an amazing compound. How does THC work? THC works via interacting with the endocannabinoid system. I'll get on to more of that later, but there's two main receptors in the endocannabinoid system. Cannabinoid receptor 1, which is more central, neural acting. It works on things such as pain, neural response, and cannabinoid receptor 2, which is more peripheral. It's associated with inflammatory response and immune modulation. So THC, it's the principal cannabinoid, and it's responsible for the majority of its medicinal effects. THC is the plant version of anandamide and 2-AG. They're our body's endocannabinoids, the cannabis that is made within our bodies, and it helps to keep our body regulated. It helps to keep our body in balance, in homeostasis. THC effectively mimics these our body's endocannabinoids within our body. THC, of course, coming from the plant source. So THC is amazing in the sense that a small amount of THC will upregulate our body's endocannabinoid system, making it more sensitive to THC, but also more sensitive to our body's endocannabinoids, 2-AG and anandamide. So it's a compound which is self-fulfilling in its way. It helps assist itself to help us and keep our bodies healthy. THC works via interaction with the endocannabinoid system, and it depends on the amount of THC we put into our body and where that THC interacts with our body. So it's dose dependent, and the amount of psychoactivity or high that comes from THC is also dose dependent. Dosing for THC varies widely. Microdosing is an option for THC, so starting as low as 2 milligrams. When dealing with moderate pain, we might use in the region of 15 to 20 milligrams a day. Severe pain, maybe 70 or even 100 milligrams a day. So it's a very variable medication, and it acts on multiple systems at once, and it can have effect from a very low dose to a very high dose, so it depends on what we're trying to treat. The next major compound, CBD, cannabidiol. Now, CBD is an anticonvulsant. It decreases the psychoactive effect of THC, so it's very useful in the fact that when using it in combination with THC, we can reduce that high and be able to increase our effective therapeutic dose. CBD on its own is analgesic, it's anti-inflammatory, it's again anti-nausea or antiemetic. It's been shown to have anxiolytic or anti-anxiety effects, and it's protective of the brain once again, so it protects our brain against future degradation and oxidative stress. The most common thing that people think about CBD, besides its health-giving properties, is it's the non-psychoactive part of cannabis. It doesn't have a high, and that's true. In fact, it's an amazing medication, and there's no toxic dose of CBD. You can literally eat it with a spoon and it won't harm you. Not to say that that's the best way to use it. Now, CBD is what's called pleiotropic. It means it has healing via several different molecular pathways. So here's a little quote here from myself. CBD has physiological effects that promote and maintain health, including antioxidant, anti-inflammatory, and neuroprotective effects. For instance, CBD is more effective than vitamin C or vitamin E as a neuroprotective antioxidant. CBD is interesting. When compared to THC, they're both amazing molecules. So THC binds directly to the cannabinoid receptor, like a lock and key response. So that's obvious how it has its effect. CBD, on the other hand, binds to the side of the receptor. It doesn't actually make cannabinoid receptors active, but changes their activity in response to other molecules such as THC and our body's own endocannabinoids, anandamide and 2-AG. So these two molecules are very useful as products of medicine and medicinal cannabis in our bodies, and even as preventative measures in health. CBD works by a myriad of ways. One important way in which CBD works is to block the enzyme FAAH. Now, FAAH is the enzyme that actually breaks down anandamide and 2-AG in our body. So it effectively increases our body's endocannabinoid levels and increases our body's cannabinoid receptor activation without actually adding any further stimulus to the receptors themselves and what we produce. CBD also interacts with the dopamine and serotonergic systems in our body, having mood uplifting effects. Serotonin and dopamine are the neurotransmitters which are associated with happiness and joy. So this is very useful in Alzheimer's, in depression, in anxiety, and many, many other ways. It's also a powerful anti-inflammatory, so it's useful in all sorts of inflammatory diseases such as arthritis, fibromyalgia, Crohn's disease, ulcerative colitis. There are, of course, many more cannabinoids in the cannabis plant. In fact, there's over 144 isolated cannabinoids that have been discovered so far, and a myriad of other molecules in the cannabis plant. But I've just given you a brief description of the two most important ones, THC and CBD, and they work better together than apart. Thanks. I'm Dr. Teh.